Joining us now, MSNBC medical contributor and former Obama White House policy director, Dr. Kavita Patel, former member of the Biden-Harris COVID-19 Advisory Board and former assistant administrator for global health and at USAID, Dr. Atul Gawande, and staff writer for The Atlantic, Mark Leibovich. And Dr. Gawande, the acting head of the CDC, is a critic of the agency. You wrote on X, has America run out of actual health practitioners with demonstrated experience improving public health outcomes? So what's your reaction to Jim O'Neill assuming this role, at least in the interim?
For the last 70 years, CDC has been headed by medical professionals with long experience demonstrating improved outcomes in public health. And now we have in place someone who has none of that track record. And in fact, the RFK Jr. and Trump have backed one person after another who do not adhere to the scientific process. That's what the people at CDC were being removed for, adhering to a scientific process.
So, Dr. Gawande, I received a text from a very prominent infectious disease expert who told me, I worked with all those people. He's referring to all the people who resigned, or Dr. Menares, who was fired. They were both historical knowledge and future leadership, totally gutted. I don't see how we come back from this. Do you share that bleak outlook?
I do. Look at the process. This is how USAID was dismantled. First, you purged staff. You then gutted the funding and hobbled the ability to actually execute on anything before it was finally dismantled. This is the same process that's been occurring at CDC. Funding has been reduced. Whole areas of work has been stopped, such as HIV prevention, such as being able to do diarrheal surveillance for all the different diseases that are common across the United States. And now we have the removal of the top leadership for simply trying to make sure that CDC is being able to present evidence. They haven't even been able to get a meeting with RFK Jr. around decisions he is making about vaccines.
Dr. Patel, I want to get your response to the news that now CVS and Walgreens are both clamping down on the COVID vaccine in more than a dozen states, in some cases requiring a prescription. How much harder does it make it for those who actually need the COVID-19 shot to get it? And what does this signal to you?
Oh, it's incredibly hard. And we were expecting this, not necessarily this soon, Ariel, but we knew that some of the changes that happened, not just in the recent days, but this has been building starting in June with the replacement of the Advisory Commission on immunization practices by RFK Jr., firing basically people with expertise that Dr. Gawande mentioned and replacing them with people who are still currently known vaccine skeptics and have been stoking misinformation. So what is it actually translating to on the ground? Ariel, people, including people in my own family, have no idea. Can they get the vaccine? Can they get it today? Do they have to pay out of pocket? What will happen? What do you do for your children? What if you don't have a high-risk condition? What are those conditions? What if you're a pregnant woman? All of the information that's been thrown around is confusing, and it's all coming to a head at pharmacies and doctors' offices. Guess what? Trying to get a prescription, not going to be that easy when you can't get an appointment. So these tensions are just going to mount, all while we're seeing an uptick in cases and we're entering a respiratory virus season.
Yeah, I already know people who are going down with COVID at this moment. Dr. Patel, right. Secretary Kennedy sent a letter to the CDC staff saying that they are looking to, quote, restore trust in the agency. Do these moves do that?
No, the restoration of trust would have happened by not replacing the Advisory Commission, by not creating the cuts that took away career staff who work on data sets, who work on hospital surveillance mechanism, who work on wastewater surveillance. The trust was eroded, Ariel. We don't even talk about it because so much has happened. There was a period of time where they took down HIV PrEP, COVID, all these information pages from the CDC right after inauguration. That's when trust went away. Care for transgendered individuals, that's when trust was eroded. To get that back is going to take real leadership and real courage. And some of the most courageous people that I know in public health have walked out the door, have been forced out the door, and their names are prominent. And you've talked about Dr. Menares, but there's so many others behind her and in front of her that have had to step down because this weaponization, as others have referred to.
There have been a lot of people who have been critical of the CDC, the stance on lockdowns, and how the COVID-19 pandemic was handled. But that is a far cry from seeing some of the measures that we're seeing against vaccines that have been tried and true in the past. Mark, President Trump told RFK Jr. to, quote, go wild. He has not seemed to waver in his support of Kennedy, even when he ended that funding for mRNA vaccine research to the tune of $500 million. Trump has also told his donors in the same breath that those vaccines were one of the biggest accomplishments, Warp Speed, one of the biggest accomplishments of his first term. So is the president in lockstep? Is the president agreeing with some of these moves that Kennedy is making here?
It's a curious question because objectively, Warp Speed was, I'd say, one of the 2 or 3 best accomplishments of his first term. I mean, getting the COVID vaccine developed and distributed as quickly as they did was an extraordinary thing. And of course, he can't really talk about it because many people in his base are deeply upset by vaccines and have been influenced by the stuff they see on the internet and so forth. And obviously, RFK Jr. has been a prime driver of a lot of this information or misinformation, if you sort of look at it that way. I think the other part of this is, and I hate to reduce very serious medical and scientific issues to a political issue here, is that in the last week or so, or last few weeks, this has become a real political distraction for President Trump. And the CDC is an organization highly respected until fairly recently, which people have sort of looked to for guidance, but also as an apolitical and sort of purely scientific force in the government that they can look to for reliable information. And these are not, low-level people who are walking out the door. I mean, these are people who have worked their entire careers, are at the tops of their profession, and who bring real expertise to that organization and cannot be replaced easily. So Trump obviously is watching this and seeing what kind of attention he's getting. And it's also you also have to wonder at what point he gets a little bit weary of the kind of roughshod treatment that Kennedy is visiting upon a lot of these institutions.
So, Mark, though, this begs the question, where is Congress in all of this? Is there any oversight of what's going on at the CDC? I know that this seems to be mostly politically driven, but you have senators like Cassidy, who's a physician himself, who actually voted to confirm RFK Jr. You have Susan Collins expressing their displeasure with what they're seeing and saying to hold up on any kind of decisions on vaccines. So what is Congress doing? Obviously, Democrats are expressing their concerns as well. What can they do?
I mean, Congress had their opportunity to weigh into this largely when RFK was up for confirmation, and there were a lot of officials that came before them. They asked questions. I think obviously Cassidy has probably got someone who's gotten the most attention because he raised the most questions. In the end, as you mentioned, he came around and supported RFK, and it probably has been his certainly most visible backer. He probably has second thoughts, but he hasn't really talked about it that much. At this point, certainly they can raise questions. They can call people in for more hearings, but you sort of have to wonder, is anyone going to listen to them at this point? They had their chance to really weigh in. They did, and they sort of forfeited their influence several months ago. So I don't know how much good it could do at this point, but obviously they're still there, so they can speak. They have a mantle. You got to wonder what good it does at this point.
Yeah, and we'll see if they take this up, given the heavy lift that they're going to have when they get back in session. Dr. Gawande, Dr. Dimitri Daskalakis, who directed the National Center for Immunization and Respiratory Diseases, which oversees vaccines, wrote in his resignation letter that the vaccine committee, quote, ignored all feedback from career and staff at the CDC. So I got to ask the question, who is left to guide these critical issues of public health and these decisions?
Yeah, who is exactly advising and writing up what RFK Jr. is putting out right now about vaccines is a mystery. There is not, in fact, a transparent process or gold standard science that they argue they're trying to deliver. It's a shock to find out that CDC experts who have produced reviews of all of the evidence and research that are out there about vaccines like the measles vaccine or other ones that are up for discussion, were not even allowed to brief RFK Jr., could not get appointments, and have no idea where the write-ups are coming from. All they could note was that the work was shoddy, that there was manipulated data and predetermined conclusions in what's being put forward, and that's why they had to resign.